The FDA has now approved the use of the updated COVID-19 booster shots for kids as young as 5. Joining us now to talk about this is Dr. Bill Hartman, principal investigator for the UW Health Pediatric Moderna COVID-19 vaccine trial. Perfect guy to talk to about this sort of thing. So what does this mean now that this booster is available for younger kids?
Well, booster doses now can be shipped out so that kids can get these shots in their arms. One of the concerning things, though, is that across our country, only about 30 to 35% of the kids eligible between the ages of 5 and 11 have actually received their primary vaccination series. We have to do a better job. We have to get these kids vaccinated to keep them and their families safe, their communities safe. The booster, the new bivalent booster, is only going to be eligible to the kids who have received that primary series. And so get your kids vaccinated and then get them this booster.
That makes a lot of sense, and I thank you for clarifying that, because I don't think that a lot of people do realize that. You can't just get this as your first one and done. For a lot of parents, if their children have had COVID, if they've contracted it over the last 6 months, and they're kind of worried about getting the COVID-19 vaccine, is it still necessary to get the vaccine even though they actually had the disease itself?
Well, we think so, and for a couple of reasons. There was a study recently from Scotland, another one here looking at 200,000 people in the United States. And the vaccine was actually protective somewhere between 30 and 40% against the development of long COVID. Long COVID described in these studies as symptoms that include breathlessness, palpitations, heart palpitations, brain fog. These things are definitely prevalent in people who've had severe COVID. It's bad enough that they've had to be hospitalized. Mm-hmm. And so if we can prevent people from getting that severe COVID, which is what we can do with these shots and with these boosters, hopefully we can prevent people from developing these crazy long COVID conditions.
Let's talk about another virus that is very top of mind for so many people right now, the flu. Cases are on the rise. Kids are back in school. It's that time of year. Another reason to get the flu shot as well?
Absolutely. Now, the flu shot is available almost at everyone's workplace. The flu shot is a very good, very effective way to combat developing this virus. The positivity rates for flu in the last couple of weeks have gone from almost nothing to 2.5%. So we are seeing an increase in cases across the country. The flu shot is the best way to prevent you from getting that flu. And so when it's available, get that shot in your arm as well.
Dr. Bill Hartman, we always appreciate your insight. Thank you.